Abdul Hai, because we know limited drugs are available, especially systemic drugs are available in our country to treat this cutaneous infection. In your opinion, a drug is responsible only for the causing of antifungal resistance? Professor Hai.
Thank you, Honorable Chairperson. One of my most favorite professor of Bangladesh, Professor Lieutenant Colonel Dr. Wahab. Respectable keynote speaker, my favorite dermatologist, Professor Rashid Mohammad Khan. Well-regarded panel of experts, Professor Galib Bhai and very dear Professor Dr. Asifuzzaman, and all the participants, dermatologists and viewers. First of all, a very good evening to all of you. I'm going to answer the question of our chairpersons, but before going to the answer, I like to add a few things of the today's topics. First of all, I like to Professor Rashid Mohammad Khan for his very excellent presentation. And I like to add few things. That one thing is that I like to say about the history of our antifungals. You know well that at the end of 1950s, our first antifungal was discovered, and this was the Polians group. Among this Polian group, there was amphotericin B and nystatin B, etc. And these drugs directly act on the fungal cell membrane, that is the on ergosterol. And we know well that human cell also contain cholesterol, which is analog to ergosterol. So in fact, it was toxic in nature. And after 20 years, that is in 1970, there was a breakthrough. That is another discovery of the group of drug that was the azoles. Azoles acts on biosynthesis of ergosterol in its early stage, and thereby it is inhibit the ergosterol, and thereby it works. But its negative side was that it involved the cytochrome P450 system, and it was the fungistatic in nature. And after 30 years, another group, it is in 2001, another group of antifungal agent discovered, that is the echinocandins. The one of this group of this drug is the caspofungin. This was a very nice preparation, and it was inhibit biosynthesis of ergosterol. But this group of drug was fungicidal, and our dermatologist, actually, our experience was limited because actually it was used in systemic mycosis. And fourth class of drug that was available in our country from the 1970s, that is the allyl amines. So actually the fourth class of drug already we have. And among this four class of drug, only two class of drug we are using mostly. One is the azole groups, and another is the allyl amines group. So among these two groups, a lot of drugs are now going to resistant. The first resistant case was discovered in 1961. It was the glycopholvin. And in 1980, we have found that ketoconazole was resistant. That is the one of the azole group of drug. And 2003, we have seen terbinafine also resistant in few reported cases. And nowadays, we have seen many reported cases of the azole resistance, and it is now called that about 19%, 19% case is resistant to azole drugs. So this is a crisis time, and we have only little arsenal for fight against fungus. So there was some thinking in the medical expert how we should combat it. Already, Professor Rashid Mohammad Khan discussed elaborately about the mechanism of drug resistance. Like he said about the biofilm formation, he talked about the drug efflux, he said about our environmental factors like use of fungicide in agriculture. I just add one thing is that there is some point mutation which caused the drug resistance. Like ERG11, it is we have seen these gene alterations in case of targrafin. ERG3 gene alteration we have already seen in the azole group. So this is one of the very important, that is the gene alteration. So it is the in this point we must see that this is the challenge, because development of new antifungal drug is a challenge, because fungal cell is a eukaryotic cell and our human cell are also eukaryotic cells. So whenever a drug is come in market, it causes some question about the safety of this drug. And usually we have seen that for any antifungal drug, there needs more than 8 to 10 years for FDA approval. So at this moment, they are thinking about how we should develop new drug. And we have seen that all the drug, all 4 classes of drug actually target only few. That is the ergosterol or only the cell membrane. So we are now searching the new target. So scientists are thinking mainly 4 ways. One is the development of the chemical compounds of already traditional antifungal drugs like azole groups of drugs like that. Another thinking is that we try to discover few nanoparticles so that it can carry antifungal elements more effectively to fungal cells. And most importantly, which I myself also interested in another research, is that to development another things, we should change our target. That we discovered vaccine and also immunomodulatory drug. We have seen this in the case of viral warts. In some strains of viral warts, actually is sensitive to some vaccine. Even some immunomodulatory drug like immunocoinot is working nice in genital viral warts. So like that, in fungus, there is some research in development of vaccine and immunomodulatory drug, etc. So in this moment, we are in the position of thinking in the new way, not only the old way. But in this moment, we have some weapons and we should use it most, I think, intelligently. Already mentioned Professor Rashna Menon that we must change our lifestyle. He emphasized about our personal hygiene. I agree with that. And about the combination of many drugs, it is I think, very difficult, because any systemic drug combined with another systemic drug is really a risk for human being, because all the antifungal in fact some kind of toxic drug. But now we are seeing in literature some combination of systemic antifungal with other group of antifungal drugs like cyclosporin A, like lipid lowering agent, like calcineurin inhibitor, like anti-nucleostic drugs, and these are in the research. But still now we are not confirmed about all the safety of these things. But I think that very important is that if we use these drugs which are available now, just rationally, that means appropriate dose and appropriate duration, that will be nice. So thank you, sir, for your for giving me the floor, and I like to thank Navana Pharmaceuticals, especially Dr. Imtiazur Rahman, Manager of Medical Affairs and Training, for arranging so nice webinar. And it is really very time demanding, and I think it is very helpful for all the dermatologists of country. So, sir, thank you, sir, Professor Wahab, sir.
Thank you very much, Professor Hai, for your elaborate discussion about the drug particularly used in the treatment of cutaneous fungus infection. Dr. Mahbub, can you hear me? Dr. Mahbub is not. No. So